Starting from a very young age, kids get vaccines. It hurts them, they cry, people are afraid of them. 57% of the friends I interviewed said that they would give up vaccines for good. But why do we really need them? And how does our federal government help us get them? In 1948, my great-uncle was diagnosed with polio. He was 12 years old, the same age I am now. He walked with a limp for the rest of his life. In 1955, Jonas Salk invented a polio vaccine, and in 1957, Albert Sabin came up with an oral vaccine for polio. Since the first vaccine was invented, polio has been nearly extinguished from the US and from most of the world. Now, in 2011, if I were diagnosed with polio, everyone, my friends, my family, my doctors, would be surprised. But we're still searching for a cure for many of the diseases in the world today. At the National Institute of Health, the NIH, people search many hours a day for vaccinations that will help our immune systems fight off these deadly diseases. I talked to Dr. Anthony Fauci, the head of a portion of the NIH.
So if you talk about the priority plans, for example, of the institute that I direct, which is the National Institute of Allergy and Infectious Diseases, our top priorities over the next several years are an HIV vaccine, a malaria vaccine, a tuberculosis vaccine, and a vaccine that what we call a universal flu vaccine, namely a vaccine that you can give once or twice in the lifetime of an individual that would protect them against all influenzas.
But once we have the new vaccines, what do we do with them? The government can't produce enough of the new vaccines for everyone. Therefore, a partnership between the pharmaceutical companies and the research facilities have formed.
The NIH never produces a vaccine in large quantities. Our role is to do fundamental basic science, translate it into preclinical and clinical, and then hand it over to a pharmaceutical company so that they can produce it in large enough quantities to be made available for the American public and for the global public.
Sometimes, however, the government feels the need to step in. This happened last year, in 2009, when the H1N1 epidemic swept through, leaving millions sick, dying, and dead. The federal government decided to step in and take total control over the production and distribution of the vaccines. The federal government didn't allow the pharmaceutical companies to take control because they felt that it was their duty to make sure to keep as many people healthy as possible.
And so the government needed to be involved because this was an unusual situation, and government went ahead and just put the money out there for the production of a rapid vaccine. After the regular flu had been already produced, the government had put all this money and bought all these immunizations to be given. We provided the immunization through our clinic last year, but the H1N1 vaccine came given by the government. We didn't have to buy it. The government bought it as a whole and then distributed to the higher risk population, which we, the pediatrician, got a lot of them because we were giving it to the highest risk for this specific flu.
But how much control should the government have? Currently, about 17% of Americans are without health insurance. Because of this, millions of Americans don't get the vaccines they need.
Well, the vaccines are actually free through the county. You can either get them if you don't have insurance. Let's say that a patient doesn't have insurance, but if they don't have insurance, there is an insurance through the Maryland, government, and the Maryland government covered children's much more than actually they do cover adults. So most of the kids maybe even cover when the parents are not covered because the parents earn enough not to be covered themselves, but not enough to have insurance for the kid, and the Maryland will cover them. But even when they don't have that insurance, let's say that they are earning enough money to not be covered by the insurance, but they don't have an insurance right now, there is a program through the county in which we, the pediatrician, get vaccines that are free to us that we are to administer on those kids.
In Maryland, where I live, kids without health insurance can still get the vaccines they need. But in some states, as Frank Sloan says, this is not the case.
Children who have health insurance plans that do not include immunization can receive vaccines in the private physician's office in some states, but not others.
So, Sloan suggests that there be a requirement that all insurance companies provide vaccinations and that anyone uninsured gets federal assistance.
The mandate addresses two concerns. First, immunization is too important to the nation for anyone to be left uncovered. And second, that keeping immunizations linked with existing medical care is essential.
Even though shots hurt, they help us. The federal government sponsors vaccine research, steps in emergency situations like the 2009 swine flu disaster, and helps those without health care. The federal government should make it its mission to help the American people and to make sure everyone's as healthy as they can be.